My name is Jeffrey Davis, and I'm a respiratory therapist at the Cleveland Clinic Heart Center in Cleveland, Ohio, and I'm here to demonstrate the technique for using the Combicath to retrieve a blind, protected bronchoalveolar lavage for gram stain and quantitative culture. An important feature of the Combicath is that it is a dual lumen catheter with a plugged, protected tip. As you pass the catheter through the endotracheal tube, this protected tip will help to avoid upper airway contamination of your specimen. As you can see, the Combicath is a dual lumen catheter. The inner lumen is protected by the outer lumen and the polyethylene glycol plug. Once you have placed the tip of the Combicath into the lower lobe of the lungs and you have withdrawn 3 centimeters, you will remove the guard, advance the inner catheter, expelling the plug. You now have a sterile catheter in the lower regions of the lungs that has not been contaminated by the upper airway. It is important to use consistent guidelines when identifying patients for a mini BAL to identify a ventilator-associated pneumonia. New or persistent infiltrate on chest x-ray, as well as 2 of the following: purulent secretions, elevated temperature, or elevated white blood count. Here at the Cleveland Clinic, we have determined patients who have had lung surgery, massive hemoptysis during suctioning, or a low platelet count as contraindications for obtaining a mini BAL with the Combicath. Now it is time to gather your supplies. The Combicath kit, which has all the supplies necessary to do your procedure: a sterile drape, non-bacteriostatic normal saline, syringe, your airway adapter, and your specimen cup. You will also need sterile gloves and a mask for universal precautions. As you can see, we have 30 cc's of non-bacteriostatic normal saline along with a 5 cc airhead. As we invert the syringe, the air will be the last flushed through the catheter to ensure that all the saline has been flushed through. I'm now going to demonstrate the technique for using the Combicath. First, increase your FiO2 on the ventilator to 100% and pre-suction the patient. We are now ready to perform our procedure. I have already placed my sterile gloves, and ordinarily I would be wearing a mask at this time. The airway adapter has already been placed in line in the ventilator circuit, and I have drawn my normal saline. I will pick up the Combicath and snug the guard down so that it does not slip loose. I will withdraw the Combicath from its sheath and begin to insert it into the airway adapter. When resistance is met, you may be in proper placement to perform your lavage. To ensure this, withdraw the catheter slightly, twist, and continue to advance the catheter. Once resistance is met, you are ready to perform your lavage. Withdraw the catheter 3 centimeters. Remove the guard, insert the inner catheter, inject the lavage, and immediately withdraw your specimen. Remove the syringe and remove the catheter from the airway adapter. Inject your specimen into the specimen cup, maintaining sterility. Suction your patient and then return your FiO2 to the previous values. The Combicath is a blind procedure, and you'll notice that there are no markings on the Combicath catheter, as the location of the catheter for your specimen will vary from patient to patient. What if when withdrawing my specimen I do not retrieve anything back? There are two possible answers to this question. If you are generating too much negative pressure, it is possible that you are collapsing distal airways of the lung and trapping your solution distal to your catheter. If this is happening, simply by stopping and pulling back a little more gently, you should be able to retrieve your specimen. Another possible reason is that the tip of the catheter is lodged up against the wall of the airway. To alleviate this, gently twist and withdraw the catheter no more than 1 centimeter while withdrawing your specimen. Is sedation required for this procedure? While sedation is not necessarily required, many facilities across the nation will increase sedation for patient comfort. Will the patient cough during this procedure? The patient may cough during the administration of lavage. However, you do not want to stop the procedure at that point, as you want to retrieve your specimen as quickly as possible. As you can see, the Combicath is a short and easy procedure. The dwell time in the lung is generally less than a minute. The short procedure time and small lavage volume are important for patient safety and comfort.